Well, good afternoon. I can't stress this enough. We're at a critical point right now. Many of the health indicators continue to surpass the worst case scenario. And as we've shown from the beginning, when it comes to keeping you safe, this government will not hesitate to act. The situation is changing quickly, and we need to respond. Right now, I'm extremely concerned about the new variants, the South African variant, the UK variant spreading in India, and the Brazilian variant that is spreading rampantly in BC right now. And we need the federal government to look at tighter restrictions at our borders to protect us from these deadly variants of concern. And here at home, we have taken decisive action to get the spread in our communities down with the stay-at-home order announced last week. We need some time for the actions we've taken so far to start having the effect we need. And our best defense right now is staying home, limiting mobility, staying the course when it comes to health and science. But the next few weeks will be critical. Right now, we need to do everything possible to get ahead of these variants. And unfortunately, that means looking at our schools. I know this is not what many of you want to hear. Minister Lecce and his team have done an incredible job keeping the schools safe. But until we get the numbers in the community down to where we need them, the problem is not in our schools, it is in our community. And bringing our kids back to a congregate setting in school after a week off in the community is a risk that I won't take. Because we know that the more COVID spreads in our communities, the more likely it is to get into the schools, and that would create massive problems for all of us down the road. My friends, no one wants our kids in school more than I do. That's where they belong. But with COVID spreading like wildfire, with these deadly variants taking hold in Ontario, we simply can't be too cautious right now. We have to be proactive. And when it comes to keeping our kids safe, I will never take unnecessary risk. That's why, based on consultation with Dr. Williams and our health officials last night, today we're taking further action. We're moving school online only after the April break. We'll keep a constant eye on the data, on case numbers, hospital capacity, and ICU admissions to determine when we can get kids back in the classrooms. I want nothing more than to be able to open the schools up again as soon as possible. But we all need to work together right now to get the community spread under control. Folks, that's how we get the schools open. Minister Lecce and his team have done an incredible job of getting our online learning system up and running. Thanks to this online learning system, we can ensure our kids keep learning remotely, even with some disruption. And we will ensure we have childcare options in place, because I know this will be very, very hard on many working families. This was not an easy decision, but it was the right decision. Childcare for non-school age children will remain open, but before and after school programs will be closed. We will also provide free emergency childcare for school-age children of healthcare and frontline workers. And we're working on a robust childcare plan for many workers who cannot work from home. Minister Lecce will provide more information on these measures in a moment, but I want to assure you that we will continue to prioritize the vaccination of education workers who support students with special education needs right across our province, and all education workers in select hotspot areas. Moving students to remote learning will allow more time to deliver these vaccines, and we're making tremendous progress every single day. By the end of today, we will have administered over 3.3 million vaccines. That's 3.3 million vaccines. I continue to ask everyone to get a vaccine as soon as you're eligible to do so. I got mine on Friday. Please, folks, this is how you can help us get kids and teachers back in school as soon as possible. All Ontarians who are eligible can book their vaccination appointment by visiting ontario.ca/COVID-vaccine or by calling 1-888-999-6488. That's 1-888-999-6488. And we're rolling out vaccinations at pharmacies across the province, with more added every single week. If you'd like to go to a pharmacy, visit ontario.ca/pharmacy COVID vaccine to find a neighborhood pharmacy that is administering vaccines. We have come so far already, and if vaccines keep coming in from the federal government, we expect to have 40% of Ontario adults vaccinated by the end of the 4-week stay-at-home order. But we must remain vigilant and give ourselves every chance to beat this pandemic.